Good morning. Today we'll be talking about hypertension. It's something that people are going to roll their eyes up and think, oh, I've heard it all before, but you haven't. And it's important that you stay tuned. Thank you, Dr. Umeizudike and Dr. Sodipo, for coming on the program. It's a pleasure to have both of you here with us.
Thank you very much.
Dr. Umeizudike, you're a nephrologist. You're a person who sees the other end. You know, we always talk about hypertension as a silent killer, but people know that it's silent, they know that it's there, they may or may not have symptoms, but you're on the other end where you see where the bad cases come, get to as a nephrologist. So can you tell us a bit about what happens, for people who are ignoring that high blood pressure and thinking it's not bothering me and it's not my portion and all that? What happens to people if they ignore hypertension, if they let it go on for years and years?
All right, thank you very much for this opportunity. And I think hypertension is something that is prevalent in not just our society in Nigeria, Africa, globally. So about 1 billion people all over the world are affected by high blood pressure. And in Nigeria, the statistics is as high as 3 to 4 out of every 10 Nigerians is likely to be having high blood pressure. And when we look at it as the #1 cause of kidney failure in Nigeria, which means that when people are undiagnosed or even when they are diagnosed and they don't take their meds, they are at risk of developing chronic kidney disease. And chronic kidney disease is a disease that is also growing in prevalence. All over the world, about 800 million people actually have chronic kidney disease. In Nigeria, the statistics is not very clear, but screenings have been done shows that between 15 to 25% of Nigerians have one form of chronic kidney disease or the other. So when that chronic kidney disease in its early stage is not treated, because we also refer to chronic kidney disease as a growing epidemic that also can be referred to as a silent killer. Many times in the early stage, there are no symptoms, completely asymptomatic like high blood pressure. But hey, what do? We need to tell people that when they are diagnosed with high blood pressure and they don't treat, there is a high chance that they may go on to develop late stage of chronic kidney disease and they will need dialysis. And dialysis is not cheap. If you look at how much people spend on medications on a monthly to treat high blood pressure, it's not comparable to how much they will spend on dialysis. Dialysis will be costing at least 400 to 500,000 monthly. Medications for blood pressure can be as cheap as 10,000 monthly. So if you look at that cost benefit, if you're able to treat hypertension on time and prevent kidney failure, the person is well off. Even in advanced countries where there is funding for both dialysis and even antihypertensives, the governments are finding it difficult to maintain that treatment, whether it's the NHS or in the US or all over Europe or Japan. They're finding it difficult to maintain people on dialysis, and they are going the way of prevention because prevention is the way to go. So it's something that people need to be wary about, they need to know about it, and they need to treat it. Thank you.
Okay, thank you. So I don't know if what you were trying to explain earlier was that hypertension leads to chronic kidney disease. But on the other hand, were you also saying that chronic kidney disease also leads to hypertension?
All right. So in some form of chronic kidney disease, because we define chronic kidney disease as presence of kidney damage or reduction in kidney function lasting 3 months and above. So there are some forms of kidney disease that will manifest as some form of damage, structural damage to the kidneys. But as it progresses, in that early stage when there's a damage, there is no hypertension. But as it progresses to stage 4 and stage 5 chronic kidney disease, hypertension develops. So yes, hypertension can lead to chronic kidney disease. At the same time, some forms of chronic kidney disease will manifest as hypertension as they progress.
Mm. Wow, that's very interesting. I think, this is something that people don't like to look at. Because when they look at hypertension, I mean, if I can just start talking to Dr. Sodipo. Dr. Sodipo, you're a GP. In your GP practice, when you pick up people with high blood pressure, how do they react to it? When you tell them you have hypertension, do they readily accept and go on treatment? Do they run away and you don't see them again and say that it's not my portion? I mean, what kind of reactions do you have when you hear that, or when they hear that?
Well, I think it's usually quite challenging, depending on who we are exactly speaking to. From my own observation as a family physician, we're seeing a lot of challenges, especially with younger people coming down with high blood pressure. So imagine somebody walking into the clinic, 18-year-old or 20-year-old, and maybe just came for something else, and maybe going for maybe NYC, or going for just came for
Mm,
some other complaint, and having the blood pressure checked and being told that it's high. Of course, the person says no. Maybe your machine has a problem. Is it the machine you're using? Have you used the manual type? Because this looks like an electronic one, and you use the manual one and you get the same reading, and it's like, no, what's going on? So I think it's a very big problem across all the age groups. But one of my biggest concerns with hypertension now is that we're seeing a lot of younger people developing it. And as Dr. Umeizudike mentioned, people don't want to treat it, and they are even the ones that are at risk of having more complications as the disease progresses, because there's a myth that only older people can have hypertension. When you combine this with the fact that nobody likes taking medications, and people believe there's always going to be a quick fix somewhere, maybe some complementary and alternative option, or going spiritual, then you know how serious the problem is. I mean, we are seeing a lot of people coming down with strokes. I mean, that's a very, very big problem. And these are people that are maybe at the prime of their age, 30-year-olds,
mm,
40-year-olds, and suddenly they have some stroke. And if they are lucky, they survive it. If they are not lucky, they die. And even people that survive it, imagine somebody not being able to move an arm and a leg from the age of 30 going on. So these are some of the challenges that we are seeing. And that's why it's good that, we are discussing these issues, so that everybody can know that it's important we screen. I always, as I end, I mean, I always remember coming up as a doctor, the aim was, okay, once somebody is above the age of 40, you need to screen for high blood pressure. But now, I mean, we're saying that everybody should screen, especially starting from as low as even 18, if there are no other reasons. But just have that blood pressure checked once, and then now know what the doctor is going to advise in terms of follow-up, in terms of treatment, in terms of monitoring. So it's really, yes, it seems like an old topic, but it's really coming with a new dimension right now.
wow. It's actually very interesting. Some years back, I actually had a mother on the program, and she described how her 17-year-old son had an injury while playing football, and they took him to the clinic. And that was when they discovered he was hypertensive.
Yeah.
And his father had bad hypertension. And I think this is another part of it is, look, people sometimes in our society hide some things, and there should be nothing hidden within a family. People don't understand the importance of family history. And if your father had hypertension, or mother has hypertension, there's hypertension in the family, there's diabetes in the family, the children must know. They don't tell them. I don't know. How do we get over that? Because there's the issue of denial, but there's also the issue of lack of information.
Yeah, so it's still the same problem. On one hand, what we've seen a lot of times in the clinics is, in the past, a lot of people died suddenly, if I should put it like that.
They just say he
Somebody just,
slumped.
yes, they slumped or there was a brief illness. We didn't have the level of health education. We didn't have the level of health exposure that we have now with some of the newer devices, being able to check even I mean, a patient doesn't need to go, or a person doesn't need to go to the hospital. Even at home, they can just get a blood pressure monitor and check. So sometimes it's because nobody even knows what happened in the family. They just know, oh, somebody died, and maybe ascribe it to some diabolical, or just something
Ritual
happened to that
attack.
person. Yeah. So now that it's becoming clearer and people are being aware, we now need to destigmatize things like hypertension. I mean, the reason why I need to mention this is sometimes too we see people come to the clinic, maybe from their employer, they're trying to do an employment test, and you discover, oh, this person is hypertensive. And it's like, oh no, please don't put it in my records because I don't want anybody to know. And then the person doesn't get necessary care. So I think we need to look at all this as we move forward.
Thank you very much. Wow, this has been very fast-paced. Dr. Umeizudike, I want to just charge in here. We had a question during the break that came out that talks about salt. Some people say salt is good for hypertensive. Some people say salt is bad. Stop eating salt. For a long time, we all stopped eating salt. Then apparently some study comes out that says, oh, actually, salt is not really bad for us. But some people say salt is bad for the kidney. So you, as the nephrologist, can you now sort of give us a very balanced but clear answer on this issue of salt? Should we all be taking salt? Is it true Nigerians take too much salt? Is there damage in taking all this Maggi and Knorr and all the seasoning cubes as well as salt? Should we use one or the other? How do we manage?
Right. Thank you very much for that question. So it's something that's been found out for many, many years that blacks especially don't handle or remove salt very well from their bodies. And the best way blacks or most people remove salt is through the, all right. So somehow the black man's kidneys doesn't excrete as much salt or push out as much salt as it should. So when there's a load of salt taken in by someone that is dark-skinned, it tends to stay more in the body. That's one. The other thing is that somehow the ability of the black also to taste salt is not particularly so good. So there's a tendency to want to take more. Okay. And then the third thing is that salt comes in almost every food that we eat. So aside from the food having its own inch in many people still add on salt while cooking, which is not bad in itself. All right. However, when somebody has been diagnosed with high blood pressure, or if there's a family history, that's why a family history is important. There's no need to hide these things. Okay. Let your children know that, hey, there's a family history of high blood pressure. So we need to be careful about salt intake at the home front. Okay. So practically, when you use the seasonings, you may want to stay off salt. And when you use the salt, you want to keep up the seasonings. It's not that you shouldn't use salt at all. So practically, if you do a tablespoon and you put salt on it and you level it, that gives you about 3 grams of salt, which is what is recommended per day. All right. So that is something that can be practiced. However, it's also important to note that when you're reducing salt in people's meal, you don't do a drastic reduction from, bam, you used to use this amount and you suddenly stop completely, gradual reduction. In that way, the taste buds will still feel that there's some salt in this food, but it's being reduced. And that's a program that a body in the UK adopted some years ago. And they said, look, we want to tell those making fast foods or even canned food, no, not fast food, canned food and fast food, to gradually take down the amount of salt that they use to prepare meals or prepare canned food. In that way, they're able to reduce the burden of hypertension in their society. All right. And there's a way to let them know that, look, if people are not having hypertension, people will live longer to eat your food or buy your products. So it's a win-win situation. If you gradually reduce to make fast canned food, you are going to prolong the life of those who are going to consume it. And you'll have more customers or more clients who eat it over many years. All right. But it's a gradual thing that should be reduced. So for both kidney health and hypertension, there's always that need to cut back on salt intake. Yeah.
Okay. Thank you so much. Now, if I can then dive over to Dr. Sodipo. Dr. Sodipo, we have a lot of challenges with alternative health. Now, there are different kinds of alternative, what should we call complementary or alternative health practitioners. There are the babalawos, there are the church healers. There are also these, I call them charlatans, the one that puts the sign up at the side of the road and says, I can heal anything. I can heal staph aureus, I can heal infertility, I can heal hypertension, I can heal weak erection. There's nothing that is not on that list that they cannot heal. And of course, they don't do it. But are people sometimes in that desperation to say it is not my portion, to not allow themselves to be labeled as hypertensive, go to these people? What do you have to say about that?
Yes, I mean, it's really a very big problem, and I'm sure Dr. Umeizudike would have been seeing so many complications that have arisen from people taking alternative medications with inherent damage to the kidneys and then to other parts of the body, not just the kidneys, unfortunately. Well, what we try to do is we need to understand that Nigerians have very strong sociocultural backgrounds, and sometimes in trying to dismiss some of this information, people just say, oh, I knew you were a doctor, I knew you were going to say this. And so they even hide it from even revealing it. I mean, I've seen people that are taking bottles of alternative roots that are damaging their kidneys and their liver. And when you confront them or just ask them in case, say, no, 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 doctor, I've never even heard of it until maybe a relative. Yes, until a relative says, Agbo, there's the famous Agbo. So the relative just says, but I saw you drinking 3 cups yesterday. And they say, no, no, don't talk, don't talk. So it can be quite something to be hidden. But I think some of the challenges too come from the restrictions. We know that, for example, as doctors, we're not allowed to advertise or promote material. So it's a bit conservative. And then secondly, the biggest problem we have is unrestricted advertising by these practitioners who should actually be sanctioned. I mean, they are everywhere. They are on the biggest TV shows with the biggest audience, and people believe what they are saying. So I think we just need to use this as a clarion call that, no, we're not saying that all complementary options are bad. I'm going to give a simple example. Somebody came into my clinic and said, oh, doctor, I take a little bit of garlic, or I take a little bit of ginger, and we have some discussions, yes, or beetroot or zobo, and we have discussions around it, and it's very nice, and everybody gives their views. I mean, we all practice now patient-centered clinical care, where you want to hear from the person and see what their own views, and you give some of the evidence, and everybody has a win-win situation, and we all move together and see how it goes. So it's causing a lot of damage. Please, I want to join Dr. Umeizudike in saying that people that take these alternative options are really doing a lot of damage to themselves. They are doing a lot of damage to the economy. They are doing a lot of damage to their families, because a lot of these things have been proven to be quite disastrous. But unfortunately, because we have weak regulations and there seems to be no punishment for anybody that just gives out anything, and people, go the other way. I mean, they just go about advertising or move from one location to another. So the complications keep on piling up. So it's quite unfortunate.
It is. Dr. Umeizudike, talking about this Agbo, because it's something that crops up every once in a while. How come there's no regulation for it? How come anybody can just wake up in the morning and put something or some tray on one young girl's head and say, yeah, go out and sell this thing? Nobody knows what's in it, and people are buying it. I don't know. Is it, but it's very interesting. They come to the hospital and then they start questioning, oh, what's this? What's that? What's this? But they will go out on the streets and buy the nearest bottle of some strange concoction, and they drink it. If I was just at a dermatology conference the other day, and people who have a problem with their hair, instead of going to see a dermatologist, they go to any untrained dermatologist, sorry, untrained hairdresser who hasn't been to school, and the other one will mix a concoction for them and they will put it on their hair. Why is it that people are so happy to just take some of these other things without understanding the implications for their health?
Okay, so I think a number of reasons. First thing is that healthcare is not cheap anywhere. So if there's no universal coverage to enable people access health at no cost to them, they will continue to look for what's very cheap and easily accessible. Look at the time they will spend to see a doctor, maybe in a general hospital or even a private hospital, and they feel, oh, it's going to take a lot of time. Let them just go by the roadside and pick something when they feel unwell, or enter a pharmacy shop and just ask for just explain themselves and get prescription over the counter. So yeah, it's something that it's of concern to us, all right? And we need
Wow.
we need help to be able to regulate some of these things. A doctor
We
cannot
do.
go even arrest or speak up against these people. But I mean, the authorities are there. I mean, the law enforcement agents are there who should be able to nip these things in the bud, because they're
They should.
causing a lot of havoc. There are
They're
people that
causing a
after
lot of death.
consuming those things, they land in the hospital and they need to do some sessions of dialysis and they can't afford the dialysis. And you wonder which is cheaper. Is it not cheaper to even go for health care and pay a little than to take something that seemingly looks cheap, and at the end of the day, they are spending so much to treat the complications? It's just
Honestly.
unfortunate. Yeah.
Unfortunately, we're really in the middle of this very important time is up. I can't actually believe it's actually gone so quickly. But just if you can give a few last words and some advice, perhaps, to people who are still getting up and taking what they call it tonic or whatever they want to call it, and they are not taking their high blood pressure medicine. Please give them a few last words to our listeners.
Okay, so first things first, they should measure their blood pressure and make sure that it's controlled. If it's high and remains uncontrolled, they should use their medications. They need to do regular exercise. They need to cut back on salt intake, try and consume, take fruits and vegetables daily. I'm sure they will be better off. Thank you.
Thank you very much. Dr. Sodipo, I had wanted you to talk a bit about how mental health perhaps interacts with hypertension. I don't know if you have time for that, to give a few words of, and also just to give a few last words to our listeners.
I mean, as has been mentioned, yes, lifestyle is critical. At this stage, in combination with medications as needed and directed by doctors and competent healthcare practitioners. And of course, we know that mental health is quite important. We've had a lot of discussions on that. I always tell people that we need to try to manage stress and look at it from, I think one of the last discussions we had was on eustress, which is the positive stress, and of course, distress, where there's a lot of problems. And yes, let's seek help when need arises. And of course, avoid those that are going to take advantage of the situation, such as some of the unqualified people who are really causing a lot of damage and causing more complications like strokes, chronic kidney disease, and heart failure from hypertension, which is a condition that can be managed, and people can have very worthwhile lives that they are happy about and live very productive lives.
Thank you. Thank you so much, both of you, for coming on the program. It's been very, very interesting.
Thank you for watching. Please like, share and subscribe for new video updates.